Okay, let me give an overview what we are going to learn today. Now remember, as we have committed, today we will be going through most basic concepts in anatomy. Now remember, we all must have gone through anatomy books. We all must have faced anatomy if you are already cleared your exam. We all must have gone through the difficulties in anatomy. Now remember, the difficulties in anatomy, I can say for the undergraduates, anatomy is 60% concept, and I can say 20 to 30% is your by hearting things. Of course, I am not saying we should not by heart. For anatomy, we will have to by heart few things, and I can say 10% is what is luck. So 60% is concept. Now remember, if you understand the concept in anatomy, it is most easy to understand various things in anatomy. Concept. Now, for example, there are different terminologies we'll be going through. Today, we'll be going through a lot of terminologies, and you may not write anything in your books. As you all know, for those who are attending for so many sessions, I will going to forward the PDF of this to you, so that you all can keep it as your reference for you, so that you can revise it in any time. You can revise it anytime. So now, initially, I will be going through a presentation. Now, in that presentation, all basic things will be covered. Like for example, how do you name anything in anatomy? Remember, it is not given in most of the books. In fact, when we start learning anatomy, what we are going to learn today, it is the most nuggets. Like for example, if you want to build a house, first thing you all need to understand is what exactly is the brick, what exactly is the cement, what exactly is the sand. If you don't understand these things, if you don't know these things, it is most difficult to build a house. So when you start learning things from anatomy book, you start from the first page. Like for example, you start with an upper limb, and you start getting all those terminologies in the anatomy. Like for example, what is proximal and what is distal, what is supination and what is pronation, what is superficial, what is deep, what is flexion, what is extension. So if you don't know these things, of course for some of you it may look very superficial, but before we go into anything in anatomy, we all should need to understand this most basic thing. So that is what I am going to go through in the first few minutes. Then I am going to show the 3D human being to you, and I am going to demonstrate all those terminologies. I am going to demonstrate all those terminologies. Like for example, what is flexion, what is extension, and all those terminologies we are going to be going through. Then I am going to come back to a whiteboard session again, and in that I am going to cover something today which will be relevant for 80 to 90% topics in anatomy. Now remember, if you understand this basic common sense, if you understand this basic concept, how exactly do we answer in anatomy, or what are the types of questions that can be asked in anatomy, when you understand these things, the whole anatomy opens up, and the whole anatomy becomes most easy to understand. So we may not go through any specific topic today, but this topic or this session will be, I can say, it is like a software or an application installed in your mobile phones. Once the application is installed, everything becomes easy, because we can do so many things through an application. So today, the first part will be, I will be going through all those terminologies. Secondly, I'll be going through an animation, and then we're going to go through something which is relevant for 80 to 90% of anatomy topics. That is what I can say. We always say this is what is a type of an eagle's view of anatomy. Like for example, imagine you are riding on an eagle and you are high up in the sky, and you are looking down on anatomy, what exactly are the things which are there in anatomy, so that we all can understand most of the things properly. And then we may go through the next few chapters and next few lectures. We'll be going through the bones, muscles and organs. That is what is being planned in these sessions. So stay connected, because I can say first year, if you are there in the first year, remember, it is the most difficult year. Now the reason behind it is the most difficult year, because we may not have seen a book, or I can say a subject having more than 1000 pages. It is only there for 100 marks. What we have seen is 200 pages for 100 marks till now. So it is easy for anybody to learn a 200 pages ka subject for 100 marks, and we can by heart things. All of you know that till now in 11th and 12th standard we survived on by hearting things. Hardly anyone tries to understand things. It is not your fault. Hardly anyone tries to make you understand things in the teaching, because by hearting doesn't remain for lifelong. All of you have been aware about, if you are asked to by heart a speech, a 10 minutes per speech, it took around for 7 days, and that too you fumbled during the speech. And that is what is the problem, because the way we were studying till 11th and 12th standard was different. The way we are supposed to study in the professional studies is completely different. We have seen so many bright students are having problem in clearing the exams, or we have seen so many not very bright students clearing the exams very easily, because what they require is the change in the way they are studying. And the bad luck is nobody teaches this, and that is what can be a problem. So as you can see, the PDF is getting created. You don't need to write down anything. I'm going to share this PDF to you. Share the PDF to you later on. So let's first go through some of the basic concepts in anatomy. Like for example, let me share with you some of the most important terminologies which are important to understand anything in anatomy. To understand anything in anatomy, you can see. Let's say for example, and I'm also going to demonstrate this to you in a 3D animation, so that you all can understand this thing properly. Let's say for example, this is what is a patient, or I can say a subject in front of you. There are some terminologies which are very important. You can see there is something like a superior, there is something called an inferior. I'm just going to run through it because most of you may have been aware about this. Superior means towards the head. What do you mean by superior is towards the head? What is inferior is towards the legs, that you all must have been aware about. We also have terminology coming like proximal and distal. Now what is proximal? Proximal is towards the center of the body, or towards the root of the body. For example, if you can see, this is what is an arm, and this is what is a forearm. So I can say arm is proximal to forearm. So proximal is towards the body, distal is away from the body. Proximal is towards the body, distal. Of course, all these terminologies will be very important before we start any topic in anatomy. Because of that, we have thought about taking this before we start anything. We also have something like medial and lateral. What do you mean by medial? What do you mean by lateral? Remember, medial is towards the center of the body. So this is what is the center. Medial. Medial is towards the center of the body. Lateral is away from the center of the body. Let me make you understand this thing in a different way. Let's say for example, all of us know that in the legs we have two bones. One of the bone is called as a tibia, and let me have you another bone is called as a fibula. So I can say tibia and fibula, there are two bones. Tibia is the bone which is on the inner side. Fibula is the bone which is on the outer side. So I can say tibia is medial whereas fibula is lateral. Fibula is lateral. This is about very first. You may have been aware about this, but I will have to take this before we start anything. Medial as well as lateral. Medial as well as lateral. Secondly, you also have something on anterior and posterior. All of us may be aware about this again. Anterior means towards the front. Anterior, for example, anterior side of the liver, anterior surface of the liver. So anterior is what? Towards the front, whereas posterior is towards the back. Again, this is very basic, very much basic. As you can see, what is the example? Pharynx is posterior to the oral cavity. Pharynx is posterior to the oral cavity. So oral cavity के पीछे pharynx है. Or doesn't mean that pharynx is all anterior or is all posterior. We also have the esophagus. We also have the vertebrae. So vertebrae are posterior to the pharynx. So anterior and posterior is with respect to something. With respect to something. That is what. So anterior means what? Towards the face or towards the front. Posterior is towards the back or away from the front. Or away from the front. If you can see, this is what is an anterior and posterior. You can also take the screenshots and share on the group later on, so everyone can benefit. Anterior is towards the face. Posterior is towards the back. Towards the back. We also have, if you can see, superior, inferior, proximal, distal. We just had a word about. We also have, yes, this is the same thing we mentioned about. Now, this is what is something which is really confusing sometimes. We also have some other terminologies, like for example, we have ipsilateral and contralateral. What is ipsilateral? Ipsi stands for same. Contra stands for opposite. So ipsilateral means same side. Same side of what? Let's say for example, you are wearing. Let's say this is what is a human being, and you are wearing. This is your right side. This is your left side. Ulta. Let's say this is what is your right side as well as the left side. So you are wearing the watch in the right hand, and you also have been wearing bangles in the same hand. Watch and bangles on the same side. So what will I say? Watch and bangles are on ipsilateral side of each other. Or I am wearing a watch on the ipsilateral side of bangles. Matlab on the same side. Or let's say if you are wearing watch on the right side and you are having bangles on the left side, then it becomes a contralateral. Refers to the opposite side. Like for example, they also say spleen, which is located on the left side, gallbladder is located on the right side. Gallbladder यहाँ पे है, spleen यहाँ पे है. It is on the opposite side. So contralateral means on the opposite side. Spleen and gallbladder are contralateral to each other because they are there on the opposite side. Opposite side. So this again is little confusing, but an important terminology. Important terminology. Again, there are positions. What is prone position? The body lying face downwards. It is also commonly called as stomach lying. Body which is lying face downwards. That is what is a prone position. Supine position. Body lying with the face upwards. Face upwards. Supine position. Supine position. Again, we have some terminologies like we have a dorsal and ventral. What is dorsal? Dorsal is synonymous with posterior, remember that. Ventral is synonymous with anterior. Dorsal is related to the back. So again, it is indirectly it is posterior. Indirectly it is posterior. Whereas ventral is related to the belly or the abdomen, that is anterior. So dorsal and ventral are synonymous with anterior and posterior. Anterior and posterior. Okay. We also have some rarely used terminology, like for example we have a volar surface, plantar surface. Volar surface related to the palm of the hand. Palm of the hand is called as a volar surface, or plantar surface is the sole. This is what is the plantar surface. Whereas also we have regional terms like an axial part includes the head and neck, which is there in the center, the trunk. Let's say we have a human being like this. So axial part includes the head, neck and the trunk, whereas appendicular part includes the limbs which are attached to this. So upper limbs and lower limbs becomes an appendicular part. Again, these terminologies will be coming up in the next topics or chapters is what we can say. The cavities and all these things are not important. Just, yes, what is very important after this is the different planes and axis of motions. So whenever we are describing any organ, whenever we are describing any movement, whenever we are describing any body parts, we always describe this in different planes. Like for example, we have, as you can see, this is what is the one which is also called a transverse plane. Also called as a transverse plane. We also have, this you can see, after the transverse plane, we also have the frontal plane. You can see frontal plane. It is the plane that divides the body into anterior and posterior. Longitudinal plane that divides the body into right and left. Right and left. Remember, so all those planes which are logical but important to understand. So we have a transverse plane that divides the body into upper and lower. Longitudinal plane that divides the body into right and left. Whereas frontal plane divides the body into anterior and posterior. Anterior and posterior. All those they are mentioned, all those things are not important. Just concentrate on this image. Concentrate on this particular image. Will be important to understand. So let me come to, let me come to the animation so that we all can understand. Let's say, let me come to the animation. There I am going to describe those things, and then I am coming to the whiteboard. I am coming to the whiteboard again. Coming to the whiteboard again. Let me have this man come on one side. Okay. Now let me discuss this. This is what is an anatomical position of the body. Let's say, for example, we are describing few things here which will be important. So this is what is arm. This is what is the forearm. This is the volar surface. I am just enumerating few things here. We have the something which is towards the head is called as cranial, or also called as superior. Something which is towards the legs is called as a caudal, or I can also say inferior. As you can see, this is what is a thigh. This is called as a proximal. This is called as a distal. Proximal as well as distal. This is the median plane, as you can see. Something which is towards the median plane is called as medial, and something which is away from the medial plane is called as lateral. So in this, and this particular surface, the anterior side, is called as the anterior surface of the body. And let me also have a posterior surface. As you can see, this is what becomes a posterior surface of the body. Posterior is something which is near to the back or towards the back. It is called a posterior. We all also need to understand in this. Let me rotate the body here. Yeah, there are different moments which are very important to understand before we go to anything again. Before we go to anything, we also need to understand the movements. Let's say, for example, all those movements are important. Let's say, for example, first moment we all have been aware about called the flexion, extension, medial rotation. We have a lateral rotation. We have adduction. We have abduction. and we have a circumduction. So all those moments I'm going to describe in this animation so that we all can understand things properly. Pay attention well. What exactly is flexion? Remember, flexion is something when the distal part of the body comes near to the body. It's very common sense of flexion. What is flexion? Let's say, for example, I'm talking about the elbow joint. What is flexion? When this forearm comes near to the arm. That is what is called as flexion. So flexion means what? Distal part of the body comes to the come towards the body. Called as flexion. So distal part. Let's say, for example, I'm talking about the elbow joint. When the forearm comes towards the arm, it is called as flexion. So elbow joint flexion. Understand the common sense, because the whole anatomy book is loaded with this. The whole anatomy book. It may be very superficial for somebody, but before we start understand these things, it is difficult to understand anything in the anatomy. That's why we are taking through this. So what is extension? Is opposite. When the distal part of the body goes away from the body. Exactly opposite. So when you straighten the arm, that becomes an extension. That becomes an extension. So knee joint ka kya hoga? When you flex the knee, the leg will come closer to the thigh. Leg will come closer, and you can only do it by bending the leg posteriorly. Of course, we cannot bend it anteriorly. So what is flexion of the knee? Is again common sense. Is when the leg comes towards the thigh. That is what is called a flexion. And when you straighten the leg, it becomes an extension. It becomes an extension. So there is again flexion, extension with respect to all the joints, any of the joints. Let's say, for example, if it comes towards the body, distal part, called a flexion. If it goes away, it is called an extension. So what is medial and lateral rotation? What is medial and lateral? Let me erase few things from here. Let me erase this thing so that we all can understand things properly. Just in a minute. Okay. So just give me a minute. This is all gone. Okay. So let's say yes. So what is medial and lateral rotation? अभी ये leg जो है, if it is rotated towards the center, it can be like this. It is called the medial rotation. That means the lateral part of the body coming towards center. Called the medial. So if this is rotating like this, called the medial rotation. Called the medial rotation. And lateral rotation is the opposite, like this. When the medial part of the body goes laterally, it's called the lateral rotation. So ये वाला हो गया medial rotation, ये वाला हो गया lateral rotation. Yeah, lateral rotation. Medial and lateral rotation also need to be understood with respect to any of the joints. Any of the joints. Let's say, for example, you rotate. For the arm, the terminology is a little different, but at least we can have the lateral part of the body, arm coming towards the medial like this, you call medial rotation. If the medial goes outward, called the lateral rotation. Called as a lateral rotation. Again, you can take a screenshot and you can share it on the group later on. Because all those screenshots, before we start anything in anatomy, these things are most important. If you start reading anatomy book before learning this, it's always going to be hard work, not a smart work. It's all going to be hard work, not a smart work. Then adduction and abduction. How exactly is adduction and abduction? Let me erase this thing again. How exactly is adduction and abduction? Adduction and abduction कैसे होगा? How exactly it will be? In the adduction and abduction, if the limb comes towards the center, it is called as an adduction. Remember, adduction starts with A-double-D. A-double-D stands for what? We are adding it. We are adding it. So adduction is you are adding something. You are adding it. That is what can be called as an adduction. And what is an abduction? It's the opposite. It is going away. So if the limb is going away, as we call it, it is an abduction. And similarly, the arm is coming toward the center, I will call it an adduction. If it's going away, I will call it an abduction. I will call it as an abduction. So with respect to anything, with respect to all the joints, and we have circumduction, we have circular movement. It will be a circular movement. Of course, all those actions or movements together, I can call it an circumduction. Circumduction is a combination of flexion, extension, adduction, abduction, all together. So these terminologies need to be understood. You can take a screenshot right now. We have a flexion. Let me revise quickly. Flexion is distal part of the limb coming towards the proximal part. Extension is distal part of the limb going away. Medial rotation is lateral part of the limb coming towards the medial side. Lateral rotation is medial going to the lateral. Adduction is coming towards the center. Abduction is going away from the center. And circumduction is all movements together. All these movements together can be called as a circumduction. You can take a screenshot right now, and I'm coming to some of the other basic terminologies in anatomy. Basic things in the anatomy. Of course, before we start muscles, before we start organs, these things need to be understood properly. Let's go to, let me erase this thing right now. Let's go to my whiteboard again. Okay. So after learning this basic things, let me make you understand one of the most important things. Yes, let me make you understand that whole anatomy. Let's say, for example, 90% in anatomy kya hai? For example, in the 90% anatomy we have, let's say, for example, joints. Let me make simplified so that if you have difficulty in clearing your exam, if you have difficulty in how exactly you are supposed to write any question, if you have difficulty in kaise padhai karna chahiye, I am going to make it simplified right now. So we have joints, we have arteries, we have veins, we have nerves, we also have organs, and we also have fossas. We also have muscles. As you can see, I'm going to share this PDF to you, don't worry, so that all things can be understood properly. So I'm going to make you explain right now, whenever you are supposed to study any joint, how exactly should you study. If whenever you are studying any artery, how exactly you are supposed to study, and vein and nerves, organs and muscles. Okay, if you can see properly, 90% anatomy mein kya hai? Only these things. So if you know what exactly we are supposed to read and write for these topics, the matters will be simplified. It's going to become very simple. And because the book which we are reading right now, remember, before we go into these things, you can have the book which we read has got sometimes too many things, because maximum the question can be asked as a long answer question. We are supposed to remember and write only up to a long answer question. If you are thinking to clear the exam on the first attempt, so you need to be smart rather than doing just hard work. It is not possible to remember everything in anatomy because most of it is theoretical. So how are we supposed to read? How are we supposed to remember things? So let's say, for example, any joint I am talking about, it can be upper limb ka joint, the lower limb ka joint. Even if they are asking about any joint, what are we supposed to read first and what are we supposed to write? First important thing is remember, for every of these there are about 7 to 8 points, and if you go through this and if you have kept this in your mind that only itna hi apne ko yaad rakhna hai, because I still remember one of my friends who said that he is going to read a Gray's Anatomy for anat book. He is going to read the Guyton. Of course, I am not saying these books are bad, but if you want to clear your exams first year, these books are having too much information that is difficult to digest, and we have not only one subject but so many subjects. So sometimes we need to be practical rather than ideal. And it is always better to be practical rather than ideal. Ideal is, yes, these books. But what is practical? Maximum क्या आ सकता है? LA क्यों आ सकता है? So we are supposed to read. Of course, I am not saying any point need to be missed. Point should be included. Every point should be included. But we will have to make it concise, because remember, these are not the textbooks. These are the reference books. And when we are going through a reference book is supposed to be read like a newspaper. Do you keep on reading everything on the page number 1, page number 2, page number 3 of the newspaper? We don't read. Because newspaper is not a textbook. Newspaper is for a reference. The news which you think is good, relevant to you, you're going to read it from line to line. But other, you read only the heading. That is what they are supposed to do. And that is what is the mistake most of the students do while clearing the exam, while studying for the exam. That is what can be a problem. So, अगर joint करके आता है, for example, what are the points in the joints? First is the type of the joint. Of course, I am not going to take any joint right now, but we are supposed to mention these points. Second, what are the articulating surfaces? Any joint has got 2 or maximum 3 articulating surfaces. Shoulder joint has got a glenoidal cavity and head of the humerus. Knee joint has got condyles of the femur, condyles of the tibia, and posterior surface of the patella. So it may be any joint. I am not taking any joint right now. Third is draw the diagram of a structure of the joint. Draw the diagram of structure of the joint. Fourth, what are the ligaments of the joint? Now, every joint has got ligaments which are strengthening the joint. Of course, like for example, we have knee joint, we have medial collateral and lateral collateral. We also have the patellar ligament. We also have all those intra-articular ligaments like cruciate ligaments and all those things. Fifth, what are the muscles which are moving this joint? Sixth, what are the movements of the joint? If, for example, we just said about flexion, extension, adduction, abduction, etc. And seventh will be applied. Now, any joint has got fracture, arthritis, and dislocation. तो कोई भी joint आता है ये 3 लिख दो. Of course, sometimes your college professor will say ये क्या पढ़ रहे, for example. But if you go through this, believe me, you will not going to miss anything and you're going to easily clear the exam. That is what is maybe our first important thing that you all should know. So if you are asked about any joint, you are supposed to write these points. Secondly, if you are asked about any artery, of course, we don't have type of the artery, we don't have an articulating surface, we don't have a structure of an artery. So arteries का point अलग है. Arteries का point is different. So what are the points in the artery? First is an introduction. That means ये artery का main क्या है? For example, let's say for example they ask about brachial artery. Is the main artery of the arm. Let's say they ask about a femoral artery. Is the main artery of the thigh. Second, every artery is a continuation of some other artery. So where exactly it's coming from? Or it is a continuation of what? Like for example, all of us know brachial artery is coming from subclavian artery. So the axillary artery. Axillary artery is coming from subclavian artery. So all those hierarchies. Third, what is the course of an artery? That means ये artery कहाँ से कहाँ जाता है. So you must remember at least 2 to 3 points of the course. Like for example, brachial artery remains anterior. It starts from the lower border of the tibia's major muscle So all those things. Okay, that becomes little theoretical right now. Fourth, what are the relations of an artery? At least remember anterior posterior relations. एक एक दो relations you can remember. You can remember. Fifth, where exactly does the artery end? Usually all the arteries divide into terminal branches. So like for example, brachial artery divides into radial and ulnar. It is the femoral artery becomes a popliteal artery. Popliteal artery divides into anterior and posterior tibial arteries. Sixth, what are the muscles, joints, skin, its supply? That means we have branches. Every artery has got muscular branches, articular branches and cutaneous branches. So we have a muscular branches, articular branches and a cutaneous branch. And seventh will be applied. Most of the arteries का applied क्या आएगा? We have where exactly it is palpated. Like for example, femoral artery is palpated on head of the femur in the femoral triangle. Axillary artery is palpated on head of the humerus. और of course इसका सारा PDF create हो रहा है, so I'm going to give it to you, don't worry, so that you can keep it for your reference. I'm trying to make it more legible so that you all can read through. If you are asked about a vein is less commonly asked, not very commonly. If you are asked about a vein, first of all, always describe the vein from periphery to center. Always describe any vein from periphery to center. क्यों? Because the blood supply flows from periphery to center. Blood supply of the vein flows from periphery to center. So again, introduction, course, relations. I have not seen branches here. Here we have tributaries, and then we have applied. Most commonly vein that is asked is the veins of the lower limb. So describe those veins in those points. Describe the vein in those points. The next thing that can be asked is nerves. Very commonly we have median nerve, ulnar nerve, musculocutaneous nerve, axillary nerve, sciatic nerve. So again we have some points we need to remember. First, the formation of a nerve. All the nerve ultimately forms from the roots of the nerve. Remember they talk about roots of the axillary nerve is T7 and T8 for example, T1. So all those things. Formation of a nerve. Second, the course of a nerve. कहाँ से कहाँ जाता है? Course need to be described depending upon different parts. Like for example, median nerve in the arm, in the forearm. Sciatic nerve in the thigh, and then end in the leg. So course. Third, relations. Fourth, which are the muscles it supply? Like for example, median nerve is also called the laborer's nerve. Supplies all the flexor compartment of the forearm, and enumerate those muscles. Fifth, what is the applied? And सारे nerves are applied. If it is paralyzed, which muscles will be not working properly? If it is getting paralyzed, which muscles will be affected? जो भी muscles nerve innervate करता है, वो muscles will be affected. And therefore becomes an applied. Of course this is general, so that you all can understand what exactly the points we are supposed to study in any part of the anatomy. This will definitely make things more easy to understand. Next LAQs that can be asked is on organs. Like for example, we have liver, kidney, spleen, we have pancreas, appendix. So all those organs can be asked. So organs के बारे में कैसे लिखना है? Of course, we don't have formation of an organ and course of the organ and all those things. So क्या लिखना चाहिए? What are the points? First is the major features. Like for example, general features I am talking about. Major general features. Like for example, if it is liver, what I am going to write is the largest gland of the body. Weighs around 1.5 kgs in men, 1.3 kgs in women. And the major features, weight of the organ as well as the other clinical or other relevant features. Second, the situation. That means which quadrant or region of the abdomen. Remember we have 4 quadrants and 9 regions. तो उसमें से कौन से quadrant और region में ये वाला रहता है, organ रहता है. Third, then we describe about the external features. Then we describe about the external. और external features में क्या लिखना है? What are we supposed to write? In external features, we write about the surfaces, borders, lobes, color, etc. Or maybe ligaments also. Like for example, liver, we have falciform ligament, ligamentum teres, right triangular ligament, left triangular ligament, etc. Fourth, internal features. Like for example, cross section. Like for example, if you ask about kidney, internal features is cortex and medulla. Cortex and medulla. Fifth, what is the blood supply? Venous drainage, lymphatic drainage. Nerve supply. Are the organs supplied by nerves? Yes, of course. Organs are also supplied by nerves. कौन से? All those are the ANS nerves, splanchnic nerves, sympathetic and parasympathetic nerves, etc. So again, nerve supply. Okay, nerve supply. Sixth is the applied part. Liver रहेगा तो hepatitis है, hepatocellular carcinomas है, pancreas रहेगा तो diabetes mellitus है. Depends upon the organ. Depends upon the organ. These are the points we are supposed to write in case of any organ if it is asked. Any organ if it is asked. Okay, then we have fossa and the muscles. Let me have fossa mentioned here. And then finally we have muscles. When I ask about any fossa, like for example, कौन से fossa है? We have cubital fossa. We have a femoral triangle. We have adductor canal. We have axilla. जब ये पूछते हैं तो भी क्या लिखना है? What are we supposed to write or what are we supposed to read rather? Like for example, first is the location of the fossa. Like cubital fossa in front of the elbow joint. Femoral triangle in the groin region, in the upper part of the thigh. Adductor canal in the medial part of the thigh. Axilla, where the arm is connected to the trunk. So location. Second is the boundaries. All fossas have got boundaries. Femoral triangle has got 3 boundaries. Axilla has got 5 boundaries. Adductor canal has got 3 boundaries again. So boundaries. Third, what is there in the roof? What is there in the floor? What is there in the contents? Roof, floor and content. Fourth, describe the contents. Like for example, femoral triangle, describe the femoral artery, femoral vein, femoral sheath. Fifth, applied. Decubital fossa is the most common location where the blood collection is happening. We take the blood pressure by auscultating in the decubital fossa. So again the general contents. And lastly, again one of the most important thing, muscles that we all also know. First is the origin of the muscle. Second, insertion of the muscle. Third, blood supply, nerve supply of the muscle. Fourth, action of the muscle. Fifth, applied, or I can also say testing of the muscle. So testing of the muscle. Any muscle, it can be any muscle. It can also be the group of muscles. But any muscle can be written in this particular way, or I can say mechanisms. If you can see, this is what the PDF is getting created, and I am very sure that 80 to 90% of anatomy is these. 80 to 90%. I may be exaggerating it, but this is how the anatomy should be studied. And we have learned about the terminologies, we have learned about the basic concept. We also have learned about how exactly we are supposed to study and what are we going to study. So now let me keep. Now I am going to share this PDF to you on the group, so you can also share with your friends if you think this is going to help. Let me keep the question and answer session on right now, so that if you have any doubt you can ask for today. I am not going to add any topic right now. Just say, for example, let's see. Yes, if you have any doubt you can just
started.
I'm happy to answer those questions. If you have any doubt right now, you can just click on the question icon. Yes, can you hear me? Somebody? Yes. Sonali, can you hear me? Sonali? Okay. Do you have any questions? You can just raise your hand. Sahil?
Sir, in same pattern, one should be in or not?
What is that?
In which pattern you should mention upon the bones?
We did not mention about?
Bones.
Bones are going to take, in the next topic we are going to start with the bones. Because bones will be maximally asked in the practicals, not in the theory. Mostly. So, bones...
For 15 marks, bones are
bones from the next topic. Next lecture will
okay,
be
sir. Thank you.
Next lecture will be bones on. Yes, give me a second. Yes, can you hear me? Somebody is there? Mrityunjay Joshi. Yes,
hello.
Hello.
Anatomic supplies to the muscle. Is there any?
I'm not able to hear you.
So can you hear me now?
No. Can you ask the question on the group? I'm not able to hear you properly. Yes, can you hear me right now? Can you hear me? Okay, if you're not able to, you can also mention your doubt on the group. Okay, so let's get connected in the next lecture for the bones. We're going to start with the bones in the 3D animation, and then we can take things forward. Thank you.